Babies arrive into this world tiny and brand new, with fragile bodies and very little of what they need to clot blood safely. In the 1930s and 40s, scientists noticed newborns bleeding, sometimes dangerously, from something called hemorrhagic disease of the newborn, now known as vitamin K deficiency bleeding, or VKDB. Researchers like Dam and Doisy discovered vitamin K in 1939-43, and by 1961, the American Academy of Pediatrics began recommending intramuscular vitamin K for all babies to prevent this bleeding risk. Decades of data show the shot has virtually eliminated VKDB in places that use it. Without it, thousands of infants would face brain bleeds or even death each year. But with that history comes controversy. Some midwives, parents, and researchers question whether all babies need the shot or if there are gentler alternatives that align more naturally with physiological birth, especially when the cord isn't clamped early and breast milk is prioritized. So let's unpack the history and purpose calmly, without fear, so you can decide what aligns with your values, your home birth journey, and your baby's safest start. Let's talk about risk, because that's what this whole conversation comes down to, right? Why take the risk? That's what most parents are asked when they hesitate about the vitamin K shot. And it's a fair question when you only hear one side. Yes, vitamin K deficiency, bleeding is real. Yes, it can be life-threatening in rare cases. But what you don't hear is how rare it actually is, or how the hospital system treats that rarity as universal. Most cases of VKDB happen when a baby is born with multiple risk factors: early cord clamping, no colostrum intake, antibiotic interference, or liver issues. But in a supported physiologic birth, where the cord is left intact, where breastfeeding is initiated early and often, where synthetic interventions are minimized, that risk becomes even lower. And yet the answer we're given is still the same: an automatic shot with no nuance. What we also don't talk about is the pain. The shot goes deep into the baby's thigh. It can cause bruising, swelling, discomfort. For some parents, that pain happening minutes after the first breath feels jarring, like a betrayal of that soft, sacred transition into the world. There are oral vitamin K options used widely in Europe and offered by some midwives in home birth settings. They require a little more consistency over a few weeks, but they work. And yet in many hospitals, they're not even mentioned. That's the deeper issue. Not whether the shot is bad, but whether the choice is even offered. And for families choosing home birth, that choice isn't just medical, it's symbolic. It says, we trust the process, we trust the data, and most of all, we trust the parents to decide. So, what are your real options when it comes to vitamin K? If you're birthing in a hospital, most providers will default to the intramuscular injection, a single dose given within hours of birth. You may or may not be told what it contains: synthetic, vitamin K1, phytonadione, preservatives like polysorbate 80, aluminum, benzyl alcohol. You might be told it's harmless. You might not be told anything at all. But if you're planning a home birth, your options open up. Many midwives offer oral vitamin K as a gentler alternative, especially in countries like the UK, New Zealand, and parts of Europe, where it's common practice. The oral protocol usually involves multiple doses, once at birth, again at 7 days, and again at 4-6 weeks. It's not as convenient as the one and done shot, but it works, especially in babies who are breastfeeding consistently and don't have additional risk factors. The key is consistency and honesty, because this isn't about fear or blind trust. It's about understanding your baby's physiology. Newborns are meant to have low vitamin K levels at birth. It's a natural state, not a defect. But in rare cases, it can become dangerous. So the question becomes, do you want to intervene for all babies or selectively based on actual risk? That's the conversation we need to be having, not one that scares parents into compliance, but one that gives them space to choose. and at home with a midwife who sees you, who knows your birth plan, who respects your baby's first hours as sacred. That space exists. You're not forced, you're informed. And no matter what you choose, oral, injection, or declining altogether, you'll know it wasn't fear that made the choice, it was you. In the end, this conversation about vitamin K isn't really just about a shot. It's about what it represents. It's about whether parents are trusted, whether newborns are seen as delicate beings in transition or simply patients to be processed. It's about how often fear is used as a tool to enforce compliance instead of education being used to build confidence. It's about reclaiming space to ask questions, to pause, to understand what's being offered before it's done. When you birth at home, you step outside the assembly line. Nothing is automatic anymore. And that means everything is a conversation. You don't decline vitamin K because you're reckless. You question it because you've been handed back the right to make decisions. You might choose the injection. You might choose the oral drops. You might decline it entirely. What matters is that the choice is yours, rooted in research, in trust, and in a birth space where your baby isn't just a chart and you aren't just a patient. That's the real gift of home birth. It's not about being anti anything, it's about being pro awareness. And vitamin K is just one piece of that puzzle, one tiny moment in those tender first hours when everything is new, sacred, and yours to protect. So ask the questions, get the information, and most of all, trust that you can hold the weight of that decision because you can. You already are.